Hello, my name is Joel Figueroa Ramirez. I am studying to be a family nurse practitioner at Regis College, and I'm representing the class Advanced Promotion in Diseases, NU629. My representation for this evening is me consisting of the pocket guide assignment that we were given, and each individual categories and subcategories that are defined in. With my pocket guide, 3-ring binder, it has subcategories, it has tabs, as you can see, introduction, table of contents, the internal categories, which comprises of, as you can see here, immunization across the lifespan, pregnancy and prenatal care, pediatrics primary care, adult health and management, geriatric care, mental health and primary care, conclusion, and finally references. Each tab is comprised of their respective location. For the introduction, basically the family nurse practitioner plays a critical role in delivering a comprehensive evidence-based care across the lifespan. Primary care requires the ability to recognize disease process early, initiate evidence-based treatments, and promote preventative care strategies. This guide emphasizes guidelines-based practice from the CDC, ACOG, ADA, and psychiatric organizations to ensure a safe and effective patient management across diverse populations. The immunization across the lifespan has the pediatric immunization, the vaccines, Hep B, DTaP, IVP, HIB, which is the influenza type B, pneumococcal, MMR, and varicella. It also has the pathophysiology, such as the live vaccine stimulates both hormonal and cellular immunity, creating long-term immunologic memory via T cells activations. Then you have the adolescence vaccine, HPV vaccine, cancer prevention, Tdaps, boosters, annual influenzas, and such. And also, the adult vaccines are included. Influenza annual, Tdaps every 10 years, COVID boosters, 19, pneumococcal vaccines, shingles vaccines, pregnancy vaccines, and influenzas. And there's also geriatric vaccines to include the high-dose influenza, pneumococcal, shingles, and COVID boosters. Next tab. Pregnancy and prenatal care. What does it include in prenatal care? Routine checkups, regular weight checks, blood pressure monitoring, and tracking of the baby's heart rate and uterine growth. Specialized screenings, genetic screening for chromosomal abnormalities between 12 to 14 weeks, and glucose screening for gestational diabetes. Stages and schedules of prenatal care. Typically, prenatal care visits, follow-ups, and schedule between 2 to 28 weeks or once a month, week 28 to 30 weeks, twice a month, week 36 to birth will be weekly. The benefits and importance, you have the first trimesters, second trimesters. Then we're going to run along to the pediatric primary care. Pediatric care focus on growth, development, prevention, and early disease detection. Developmental milestones, infancy, social smiles, and sitting, toddler, which is walking, speech development, school age, cognitive development, and adolescence, abstract reasoning. You also have the common conditions known as the otitis media, the pathophysiology of it, a brief description, and then you have the treatments that go along with that condition. The pediatricians divided care based on these developmental intervals. The neonatal stage, which is from birth to 28 days. This is critical phase, focuses on the transition from the womb care, includes neonatal screening for cognitive disease, monitoring vital signs, functions, and initial vaccinations. This page continues the process from toddler stage, early childhood, middle childhood, academics, adolescence, standard care and treatment components. Sick visits, diagnose, and treatment for acute issues such as ear infection, strep throat, and minor injuries. Chronic conditions of management, ongoing care, and specialist referrals for long-term conditions like asthma, diabetes, and autism. We also have the adult health management here. Adult health is a complex health management that is induced by prolonged chronic abuse of either substance, food, or lifestyle choices. Genetic factors may also play in a role. Common health issues are listed below, which are the hypertension. There's also the pathophysiology of the hypertension phenomenon known as RAS. Then you have the treatments that will follow along, which is ACE inhibitors, ARBs, thiazides, calcium channel blockers. And for type 2s, which is another common side effects for adults, treatments metformin, glipizide 1 agonist, COPD, and so on. And treatments for the COPD would be albuterol, inhaled steroids, prednisone. Infections, they also can have another side effect as an ongoing adult would be UTIs, and pneumonias, amoxicillin, and the macrolides family to kind of counteract the infection that they have come across. Geriatric care is a care focused on functional status, medication safety, chronic disease management, and polypharmacies that they continuously have. So as nurse practitioners, we need to focus on how many medications these geriatric patients have, what are the contraindications, and how is it affecting their physiology, and go about by changing the medications according to the guidelines. Some of the risks that geriatrics may come across is the falls, the confusion, Alzheimer's disease, dementia. You get the BERS criteria, the benzodiazepines to avoid, anticholinergics avoid, and NSAIDs cautions. The pathophysiology, a quick example of the Alzheimer's disease, and then the treatments that you can have the patient that are suffering those kinds of consequences. Finally, we come across the mental health and primary care. Typically, we associate mental health with multiple issues. There could be chronic depression, the MDDs, psychiatric hallucinogenics, you have anxiety issues, bipolar issues, and so on. For the pathophysiology of depression, I have it here listed, and the treatments for SSRI, such as sertraline, anxiety, SSRI first line, buspirion, limited benzodiazepine use, and schizophrenia, which the pathophysiology of the schizophrenia also is listed here as well. Treatments for the schizophrenia are included down below. Crisis intervention is very crucial, as well as screening for suicidal ideation. Interdisciplinary relationship is important in coming up with follow-ups and schedules to maintain a proper mental health treatment. And if anything goes beyond our scope of practice, a specialist needs to be referred to. We had the conclusion at the end. The FNP roles integrate preventative care, chronic disease management, and mental health support across all lifespan. Evidence-based practice improves patient outcome through early detection, appropriate pharmacologic interventions, and patient education. Mastery of the clinic guidelines of pharmacologic is essential for safe and effective advanced nursing practice. And lastly, we have the references here. I enjoy this class, and I am happy and can't wait to be a FNP. I appreciate everything. Thank you, Professor. I hope you enjoy the pocket guide.